It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Up first on our show today, we're going to see how Dr. Sakina Davis was able to help Samantha turn her life around with help from hormone therapy.
Lethargy, just tired all the time, anxious, couldn't let my mind relax, paranoia. And the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle. About a week or two before it happened, she would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Can I, once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
A tomato is a superstar in the fruit and veggie categories. Tomatoes contain lycopene, a powerful cancer fighter, and they're rich in vitamin C. The good news is that cooked tomatoes are also nutritious, so use them in pasta, soups, casseroles, and salads.
So John is a wonderful man. He is a father, you know, he works every day, but unfortunately he developed coronary disease at an early age, weakening of the heart because of that. So when he presented to me, the heart function was very poor.
I was a jock, watching my diet. I loved exercise. I ran marathons. I was an NCAA certified basketball and football official. And the people that I work with, they knew me and knew that I was a fairly healthy person. So when they found out I had a heart attack, everyone was floored.
Heart failure means the heart becomes weak, whether it's because of blockages or other things. Viral illnesses can cause heart failure. But for him, it was blockage, not getting enough blood, so the muscle became weak over time.
Before I started seeing her, they wanted me to run through a battery of tests. And when she saw the results of those tests, and I believe she was on maternity leave at the time. She came in and wanted to see me, and it was at that point she actually brought up that somewhere down the road I may actually need a heart transplant.
Over the years, he's been evaluated by the transplant team, and he didn't need a transplant because we had taken great care of him, and he's very thankful for that, and I'm thankful for medications and therapies that we were able to give him to keep him really controlled on heart failure.
Dr. V is an amazing person. I owe quite a bit to that woman, and I feel very fortunate that she's my cardiologist.
He did have a device, a shock box put in, so that in the event of an arrhythmia, because the vessels are not working and the muscles not working, so electrical abnormalities can occur, and people can have sudden death from heart failure. So we protected him by putting a shock box. And he has been able to work every day, but he takes his medicines, and he's doing great. So that's a great testament to having great doctors paired together and great institutions to take care of patients. And we're very blessed here in Texas because of the Texas Heart Institute.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
All of the doctors that you see on our show today have profile pages on our website, bestdocsnetwork.com, complete with bio, videos, and you can even request an appointment. Now up next, we're going to hear from ear, nose, and throat specialist Dr. C.T. Nguyen and learn more about balloon sinuplasty and sinus surgery.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have colds all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
Switching out that bag of chips with your sandwich to 3 ounces of unsalted pistachios will help raise your HDL cholesterol, which is the good kind. To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
carotid disease is a very important risk factor for stroke, and carotid disease develops because of plaque formation in the carotid arteries, especially near the carotid bulbs and involving the internal carotid arteries. Those are the arteries that feed the brain. So people who smoke, who have high blood pressure, have diabetes, these are all risk factors for carotid disease, and many times these go silent. So we try to evaluate our patients with carotid ultrasound, which evaluates the blood flow and the anatomy of the carotid arteries. If we find significant carotid disease, we either think of surgery or carotid stenting. Carotid stenting is an innovative way of treating a patient without cutting on them, which is very important. And many patients are good candidates for carotid stenting. Carotid stenting is done in usually university settings, especially here at the Texas Heart Institute. We have great interventional cardiologists who do this. Ask your doctor about carotid stenting if you have carotid disease. It's a great alternative to surgery.
For more information and to check out hundreds of videos on the great doctors you've seen on the show today, head to our website. It's bestdocsnetwork.com. Now up next, we're going to see how Dr. Cliff Thomas was able to help Zachary continue his singing career by relieving his problems with GERD.
I'm studying music education and I'm studying opera. I have voice lessons twice a week. I have choir rehearsals every day. I have opera rehearsals all the time. And so I have to be in tip-top shape. And before this surgery, if I sang for more than 30 minutes, I was done.
So some people wonder what GERD is. What's going on is the esophagus is tube that goes from the back of the tongue down to the stomach. And at the bottom of the esophagus where it connects the stomach, there's a one-way valve that should let food and juice into your stomach but not let it back up into the esophagus. When it goes back up into the esophagus, it can burn the esophagus and then cause the symptoms like heartburn and coughing, asthma, a lot of symptoms.
Acid reflux all day, every day. I mean, I would eat, acid reflux. I would not eat, acid reflux. Have a drink of water, and so it was one of those things. I would wake up in the morning with a sore throat. It would affect my singing, like I said.
So I've been doing surgery laparoscopically for 22 years for reflux and have excellent results. And what we do is an outpatient procedure. Through very small incisions, we go in there and we reduce the hiatal hernia. So that's basically where there's a little gap in the diaphragm and the stomach's protruding up into the chest. So we pull that down and close that gap in the diaphragm and rebuild that one-way valve. The operation takes less than an hour. People usually go home an hour after surgery. They're usually doing everything within a week. And they're usually getting out of the house in 1 to 2 days after surgery.
Actually, I told Dr. Thomas the results of this have been amazing. The very, very first morning after my surgery, I woke up and I almost started crying, literally, because it was the first time in my entire life that I had woken up without a sore throat.
One of the more common things people tell me after surgery is this is one of the best things they've ever done in their entire life. So this heartburn symptoms kind of is in the background of their daily life, and it may not seem like the worst part of any one day, but when it goes away, their quality of life improves so much and they don't have to live with it. They're kind of ecstatic.
It's been an amazing, amazing improvement in my entire life, and it's something that I'm so, so grateful to have had done.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point, you know, exactly what he could do for me and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
I see a lot of patients with chronic pain. Chronic pain syndromes can affect your entire life, work, home, everything. There's a lot you can do to help yourself with this, and a lot your doctor can do to help you. First of all, try to avoid narcotics. That's a dead-end street. It just covers up the pain, and the pain's still there, and it's going to come back. When you have pain today, your body produces something called substance P. Substance P magnifies tomorrow's pain, and you get in this cycle of pain, substance P, magnified pain, more substance P, and it just is a vicious cycle that keeps going on and on. So what can you do about your chronic pain? There's a lot you can do. Physical therapy helps. Getting appropriate and restful sleep will help you. If you have depression, either from the pain or just depression from depression, antidepressants can help that too. There's also a lot of medications that your doctor can use that will help reduce the pain and stop that vicious cycle of substance P and magnified pain.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, you know, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation, so I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an awesome bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed. And because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, you know, why do I have this problem? And the biggest component, genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. And then, obviously, for the females, it's wearing the high heels. You know, it's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
Well, I would love to be able to get back out there and be pain-free. A lot of times, I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for a longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, you know, that's the rewarding part to me.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager, and that permanently discolored my teeth. I tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up, and then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, you know, made her look great. Just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. You know, just in a social setting, somebody's snapping candid shots, and I would never, rarely would open my mouth to smile. You know, once I had the smile makeover, I'm just flashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but people who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile and confident about how their teeth look. It changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's, and my mother was across the room from me. My mother's 82 years old, and she looked at me and she said, "Your smile is dazzling." And I was like, "Oh, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone, and after I feel like I can take on the world. I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
To request an appointment with any of the amazing doctors you've seen on our show today, head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. Now up next, we're going to see how Dr. David Altamira was able to take a subtle approach to rhinoplasty and give Holly the nose she always wanted.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, "Oh, our kids would have really big noses."
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple, and I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process, and he said, "You know, you can always do more, but let's do something modest for now," and it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that, you know, we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face, They were never happy with their appearance. And so it's basically a great operation that can be used to reshape a person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
Hip revisions happen for several reasons. One was they just came loose, and they can come loose just because they were never put in correctly, or sometimes they just come loose. And the second reason is infection. About 2.5% of the hips put in nationwide get infected, and once they're infected, they have to come out and you have to start over. Occasionally, I see, like this patient we did recently had been infected for several years. I'd already revised her other hip that was infected, but she's in bad health and she was in a nursing home for many years and had not walked until we revised the first hip. She had not walked in 2 years, and then after revising the first one, she actually got out of bed and was able to ambulate her in the house and for short distances. But the second hip, which had been chronically infected, eventually put her back in the bed and was bedridden. And so we just replaced hers recently. And in this case, her femur was broken in several places. The infection was really bad. I mean, just a very complex 7-hour surgery. But it looks good. 20 years ago, the mortality rate from a hip fracture was around 40% of the people died within the first year. And currently that number is around 10 to 15%. And the difference is fixing it, replacing it more often than trying to fix it, replace it with a new hip, and get out of bed and get back, just get back to activity as soon as we can. I think that hip replacements, for the most part, have just been one of the few miracles of modern science. I mean, you take somebody who's either has arthritis or a broken hip that literally cannot function in life, the pain is so severe, and then do a typical normal hip replacement is an hour surgery. And you can have a hip that's absolutely normal. In fact, 95% of the hips get so good that people forget they had one. And it becomes a normal hip, and they can go on with their life and do everything in the life that they want to do, with extremely few restrictions once they're healed up. I really love what I do, but what I love most is trying to take somebody whose life is really just totally destroyed because of what's wrong with them, because of pain or disability, and trying to get their life back. And that encompasses much more than just the surgery. And that's what I enjoy. It's getting someone's life back.
That's going to wrap up this edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are really making a difference in people's lives. For more information, head to our website, bestdocsnetwork.com. And if you have a question, a comment, or a life-changing story, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.